Hi students, I'm Jeff, and today's conversation topic is hospitals. So let's go over the vocabulary expressions and questions together. So repeat after me. Surgeon, X-ray technician, patients, paramedic, ambulance, emergency room, stethoscope, needles, injection, shot, tray, chart, gurney, visiting hours, staph infection, to draw blood, a blood test, to make one's rounds, the maternity ward, to give birth, to go into labor, socialized medicine, a prescription, to take medicine, to run a fever, to take someone's temperature, blood pressure, to run some tests. And now I'll explain some of those for you. So a surgeon is a doctor who performs operations. An X-ray technician is someone who takes X-rays and develops X-rays. A paramedic is someone who provides emergency medical care and often works in an ambulance, which is the vehicle that is used to transport people to the hospital. A stethoscope is something that a doctor uses quite frequently, and in fact usually wears around his neck even when he's not using it. In order to use it, he'll put two pieces in his ears, and then the other part will be pressed against the patient's chest in order to listen to the person's breathing or heart. An injection or a shot is what you get from a needle. It's put in your arm or somewhere else in your body. A tray is something that is used to carry food or medicine on. And a chart is a piece of paper that is used to keep your medical records on. A gurney is a collapsible bed that is carried in an ambulance. A staph infection is caused by bacteria and is common at hospitals. To draw blood is to take blood out of a person's body. To make rounds is to go around and check on patients. That's what nurses and doctors do on a regular basis. A maternity ward is where women who are pregnant and giving birth to babies go in the hospital, and then they stay after they've given birth. To go into labor is to begin the process of giving birth. And now the expressions. That's just what the doctor ordered. That means it's exactly what is needed or wanted, and it isn't necessarily used just for, or even for, medical issues. It's used in general. Maybe you're stressed out and you need to relax, and you have a day of peace and quiet, or you go to the beach or something. That's just what the doctor ordered for your problem. And it's not referring to an actual doctor. I have to go under the knife. That means to have surgery. he gave her a dose of her own medicine. That means to give someone the same bad treatment that he or she gives other people. And that was a bitter pill to swallow, means an unpleasant fact that one must accept or deal with. And now the questions. Think about these in order to prepare for our conversation. 1. What are the hospitals in your country like? Have you ever been hospitalized? 2. What type of care and services do hospitals provide? 3. What do the nurses do or not do for patients? 4. Have you ever needed emergency medical care? What happened? 5. How much physical and informational privacy is afforded patients? 6. Does your country have socialized medicine, or do you need insurance? How do you feel about that? 7. Have you ever had surgery? Describe the experience. 8. Talk about the ratio of male doctors to female doctors and male nurses to female nurses. 9. Do you prefer a male doctor or a female doctor, or a male nurse or a female nurse, and why? And 10. Do you have any comments or questions about the article? Alright folks, thanks very much. Have a great day.